So, what lies before us is the necessity to reform. Now, I tried to do my part with this Health Matters Initiative that Jenny Ehrlich is running, and before that with our Alliance for a Healthier Generation. After I had my heart surgery, I made a partnership with the American Heart Association, and I said, let's do something real. I don't want to just do PSAs. Let's do something real. Let's take on childhood obesity. It's the biggest public health problem in the country. And so, first thing we did was to try to make a deal with the soft drink manufacturers like we did with the AIDS drugs people. That is, when I started this, there was a lot of evidence that in a very significant number of obese children were getting 50 to 60% of their total daily calories just from the drinks they consumed in school, in vending machines and cafeterias. So we got Coca-Cola, PepsiCo, Cadbury, Schweppes, and a lot of big juice manufacturing people too, because there's a lot of sugar in those full-size juice bottles. And we got them together, and I said, look, let's get one thing out of the way. I don't think there are any devils here. There's a lot of reasons that we have these big obesity problems. It has to do with the way we produce food, the way we distribute it, the fact that a lot of people have not had a pay raise in a decade, that more and more working families seem to have less time and less disposable income, and in almost desperation they buy food that is higher in bulk and caloric composition but lower in nutritional value. Let's just figure out what we're going to do. Otherwise, all these kids that you're filling full of sugar when they're in their 30s are going to be in wheelchairs with their legs amputated because of diabetes, and they won't be very good customers. Not because we're bad people, but because we have a system that is not working. And I said, there's got to be a way for you to make money selling the drinks in schools without doing it. Some people think sugar is a drug, but anyway, there's got to be a way for you to make money. So, long story short, they agreed to get rid of all the full sugar drinks, to go to smaller portions for full sugar juices, to go to a lot of fruit-flavored waters, to make other adjustments. And since we had way over 90% of the market in the soft drink manufacturers that were part of this, and the juice manufacturers, an independent study said last year that with no tax, no federal rules, no nothing, in the last 5 years there has been a 90% reduction in the total calories consumed by kids from drinks in more than 90% of the schools in America. Total agreement. Now, and when the federal government put out its new guidelines that explicitly acknowledged this and took account of it, so they didn't have to reinvent the wheel. We also made agreements with a huge number of the people who provide school lunches, since very few schools prepare the food on site anymore, which is unfortunate, I think, but the economics are what they are. And all these big food service providers agreed to increase the nutritional content and reduce the caloric total of their meals, and we improved the nutritional value of school meals for 30 million kids. And we've got exercise programs now in 15,000 schools. And First Lady Michelle Obama's Let's Move program is to ask our people to be the implementing partner in the school program part of it. The point I'm trying to make is a lot of this stuff may not sound like high tech, but if you're not feeding the system as many sick people, you're likely to have lower cost and higher quality for the people that do have to be treated. Now, when Jenny left that program, we started Health Matters. We did that around the Humana Challenge golf tournament we do with Humana. That's the old Bob Hope tournament. It's the first big tournament of the year in America, in the Coachella Valley in Southern California. we're trying to deal with the non-childhood population, and particularly with the baby boomers in trying to help promote better health care, but also trying to help reduce disparities in health care across all the lines where they exist. I have no idea if we're going to succeed in this, but I'm really encouraged by the significant number of companies that want to participate, because they realize that probably 20% of this disparity in what we spend and what we would spend if we had any other country's healthcare system has to do with our overload of the feed-in of people who have avoidable chronic diseases that we're going to have to reduce.